the Center for Maternal Health Equity at Morehouse School of Medicine was founded in direct response to the inequities that we saw in maternal mortality and maternal morbidity rates in the state of Georgia. We have over 800 deaths that happen annually. Black women and Indigenous women are 2 to 3 times more likely to die from pregnancy-related complications. There are 60,000 women annually that suffer from severe maternal morbidity, which are these complications that arise from pregnancy.
We want to close the equity gap. We want to be sure that people get the right care at the right time in the quantities they need and when they actually need it in order to impact their outcomes.
We think it's critically important that we hear the voices and uplift the voices of Black women when doing research. We do work on the ground in terms of improving maternal and child health, and we work with pregnant and postpartum women. And for us to be able to work with Morehouse School of Medicine to help design the survey, the interview guides, to actually be out in community and working with and interviewing women helped inform that work. This allows us to work together to, again, address these issues, because we know mental health, just as an example, there's so much stigma in the community about mental health. And so now we could be a lot more informed about how do we do interventions to address those issues.
When COVID-19 came out, it really highlighted and shed light on a lot of inequities that were occurring. And then with the racial reckoning, we were looking at what we call these dual pandemics of COVID-19 and structural racism on maternal health outcomes.
We have partnered on a multitude of studies, whether it was understanding the connectivity between community-based services and interventions, understanding the experiences of birthers in our state, specifically Black birthers, exploring near misses. A lot of times we focus on the maternal mortality issue, but we don't put enough attention on those individuals who survived, yet still have to navigate the world dealing with the complications associated with pregnancy. So they're still having to show up every day with cardiac issues, with postpartum depression, and all of those things that really affect their ability to parent.
Rural health is an equity issue. I guess in concert with us kind of thinking about maternal health and realizing the number of people that we could impact, we decided that having a rural residency program could potentially benefit the women of the state of Georgia.
Rural women, a lot of times there are healthcare deserts, or they don't have resources that they need, or they don't necessarily know where to find them in their local areas. So what we want to do is make sure that they have that information, or that we can provide them with people who can get that information to them.
We see a partnership with a community-based organization, not as a top-down approach, but an equitable partnership where together we come up with solutions and act on those solutions. We took, something that we know has been working in cancer, patient navigation, but put it back in the hands of community. So rather than nurse navigators, we have people in our community who have had lived experiences be trained as navigators, as community health workers, as doulas, and lactation counselors.
The idea is that the navigator sees them through the entirety of their pregnancy and their postpartum period to make sure that they get the best care that they could possibly receive. Lots of women get very good prenatal care, but the postpartum period is a very difficult time for a lot of people. If you can imagine, they have a new baby. And so getting up to go to that postpartum visit might be a bit of an issue. Well, the patient navigator is supposed to remind them, because it's oftentimes not a lack of desire. If they need transportation, help them to get transportation in place for both them as well as their baby. Those kinds of things happen. And when they happen, then we can pick up on, things that they might be experiencing, for example, postpartum depression, or an actual medical, another medical condition that's a physical condition that otherwise would not have been seen.
So I think the way that we're approaching technology is that we want to make sure that it's culturally relevant. So we've made sure that the content that they receive looks like them. It is presented in a way that they have endorsed. So we call it For Us By Us model, where we've actually asked the women, what can we provide for you that you can relate to and that you would actually engage with through technology. So I think traditionally technology has been developed by other people that don't necessarily look like the population, and so it's not always reflective of what their needs are.
So this work is very personal to me. I am a mother of 2, and I myself suffered from postpartum depression. I also come from the South Bronx, which is one of the poorest counties in the United States. And so when I do this work, and what I hope to achieve is that in 5 years we can eliminate the maternal health inequities that exist in this country. We need to start thinking about policies, research ideas, and interventions that start prior to a pregnancy to ensure that once a person becomes pregnant, then they're ready for this wonderful journey, right? In 2022, no woman should die from pregnancy-related complications, especially on a day that's supposed to be the most wonderful day of this person's life.